I'm here with Dr. Roddy McGee, who's a world-class orthopedic surgeon who runs his practice out of Las Vegas, Nevada, total sports medicine and orthopedics. He's also the head team physician for the College of Southern Nevada and a consultant for the UFC. He has worked for many years with some top athletes and has wonderful insight into the recovery process. Thanks for being here with me.
Thanks for having me.
Maybe you can just talk a little bit, Roddy, about some of the things about your work that you enjoy the most.
Well, it goes back to being involved in sports my whole life. It's the most important thing that I did, read about, watched on TV. It was just a part of everything I did from the time I was very young. It's been the way for me to stay connected to sports. And I always had an interest in the injuries and the advancements and a lot happened in sports medicine from the time that I was a young kid in the 80s to in college in the 90s. So I was really fascinated with some of the advancements that were happening during that time and how quickly some of the guys were returning to the field. It got me interested in wanting to learn and understand, how do you figure these things out? How do you take care of that type of thing? And probably I was starting to recognize as college went on that I was not going to be a professional athlete. And so I was going to have to get a job. So it was sort of a natural extension of the things that I was studying and had interest in to continue to learn. And then, as I said, it's been my way to stay connected to sports in some way. And it's been really challenging in terms of, learning the physical skills of performing surgery and then and all the challenges and how we have to manage athletes and help them when they come to us and their interest is in getting back to what they love.
Right. So what are some of the challenging aspects of your work in helping athletes get back prior to or after a surgical procedure?
Well, the first thing is helping them, in that initial stage and accepting that they've had an injury that's going to require a surgery, for example, that there's going to be time that they're going to have their sport interrupted. And so just having those conversations are sometimes very difficult. It's very emotional. And especially like this part of the year, each fall, you're approaching a new set of seniors in high school, for example, that they have all kinds of hopes and there's anticipation of their season, aspirations to continue and play collegiately, potentially get a scholarship. And if they've had a significant injury, now all of those things are now in question. A lot of the, fun and excitement that they've been anticipating has been eliminated. And now they have questions about what does my future hold? So it can be very tough.
And in terms of some of those doubts, I guess, or emotions that athletes have, what are some of the things that athletes present to you or that you see in your practice? What kinds of things do you hear them say or talk about when they first come to see you?
Well, they kind of go through those stages of grief. There's a little bit of the denial and then bargaining and until they finally, get to the end with acceptance. There's a lot of fear and there's times when they're, if it's the case of a kid that has the opportunity to continue collegiately, they're wondering, am I going to still have an opportunity to get a scholarship? Is all of that stuff that I thought was coming, is that over?
Yeah. And in terms of, I guess, the acceptance piece, do you notice differences in terms of athletes' ability to get to that place, or that some are able to accept it
Definitely
easier?
I mean, there's some kids show up. Yeah, sorry, I didn't mean to interrupt you.
No, go ahead.
Some kids literally show up and they sort of have an understanding of the whole thing right off the bat. They are aware that they've had an injury that's serious and they've already moved to that next stage. Like, okay, I know it's got to get taken care of and I know I'm going to be out for a period of time. Just tell me what I have to do and I'm going to listen, follow instructions, and I'm going to make sure I get better. And in that case, it's pretty easy. Like they've already walked through that whole thing themselves and they're maybe they're coming into it better equipped to handle the scenario for whatever reason. And then there's some that really don't even understand the significance of the injury. You know, they just think that this is some little speed bump in their week and they're going to be right back out there. And you're then having to explain to them, no, you're probably not participating in anything for 6 to 9 months. So when you get into that scenario, it's a lot tougher because you've got to really walk them through it slowly and help them understand.
Yeah.
And I don't even know that an orthopedic surgeon's training is adequate to support somebody in all the ways that they need to be supported. We do our best, and I try to be empathetic, and I try to, you know, help them and explain everything in detail and things like that. But there's times, and probably more recently, especially because of our conversations and conversations I've had with other sports psychologists, you know, I'm recognizing that there's a whole lot of support that they would benefit from that I just can't provide because I don't have the training and the tools to give them all that they need.
So is part of the challenge also, Roddy, that, you know, you only have a limited time frame, of course, when you're interacting with patients? Does that make it difficult to help them, you know, address some of these fears or apprehensions and anxieties that they have?
It's totally inadequate. I mean, I only get, you know, maybe 10 or 15 minutes to discuss things with them. We have, you know, sometimes there's a little bit more time. Sometimes I'll talk with them again before surgery or right before surgery, in, you know, as they're going back to the operating room, talk with their parents and things like that. But it's certainly not the setup that's ideal when there has to be a lot of conversation and understanding and, you know, gathering info that's a part of the background so you can help them walk through that. It's not built into the system for how our practice functions or in the way that most orthopedic surgery offices operate.
Yeah.
You know, we have a little bit of time for evaluating. We go over the imaging, we do a physical exam, and we talk about the treatment options and what to expect. And again, like I said, I'm recognizing more and more that the emotional and the psychological support is necessary and has been poorly attended to traditionally.
Mm-hmm.
So that's where, you know, a lot of our conversation started, and that's why we're continuing to talk more about how can we address that. It's become more apparent too, because we have articles coming out in our sports medicine journals talking about the impact of the psychological readiness to return.
Yeah.
And we know that that's a significant factor.
Yeah. And I want to come back to that point more about readiness and kind of ways that that's assessed or determined currently within your practice or others you're familiar with. But in terms of engaging the athletes, you mentioned, you know, some really kind of struggle for whatever reason, or maybe they just don't quite understand what's involved or how long the course of recovery is. How do you, within the constraints of your limited time, help manage those expectations that the athlete might have?
All I can say is we do our best. And what I try to do is you get a good sense from somebody how much they understand it. And I just go by their, you know, their verbal cues or their nonverbal cues and their verbal feedback in terms of how much they actually understand what's going on. If I see that they need more explanation, then we just take the additional time that we need and walk them through it. But, you know, what do I do and how? I mean, I'm still trying to learn and understand that. We basically try to explain things in as much detail as possible. You know, I try to ask some pointed questions in terms of the emotional side of things too. I try to express to them that, you know, I understand that and they can talk to me more about it if they need to. And then I just have to judge what their feedback is if they need more support like that. And when I see that they do, then we take the extra time or we get them the resources that they need. But this is a whole area of my practice that I've wanted to sort of expand and add to, because I recognize that, you know, a couple of sentences in the office from me may help, may be fine for some kids. They may accept that and say, I'm glad you told me that and pointed it out or asked me about this or that. And now I'm good. But then you see that there's other kids that aren't quite ready for all that. They need additional stuff. And that's where I'd like to be able to offer that. That goes along the lines of the discussions we've had.
Yeah. Well, and I think it's a great point, because just as one, of course, isn't going to regain their physical function probably just through a single repetition or, like minimal engagement with exercises, I suppose the same could be said with the psychological element. And, maybe for some, as you said, one or two statements or one or two pointed questions might help a particular athlete. But, for many people, repeated engagement with skills or kind of regular tools can be beneficial for sure. Do you see,
like with their physical ability, everybody sort of has, maybe a different level of their baseline of their, their psychological skill and ability, and exposure and training, right? Like those are, and I explain that to them when we're talking about this topic, and I start to explain this to them. And if they're giving me kind of funny looks like, okay, where are you going with this? Or what are you talking about? Or nobody's ever said any of these kinds of wacky things to me. And I explain to them, this is a skill that you develop, just like, dribbling with your left hand or whatever, something that was not easy and natural to you that you had to work at. This is the same thing.
Yeah.
But the good side of it is you can work at it and get better at it.
Right.
You can develop this skill and use it as a strength. So.
Right. And would you say that athletes are, you kind of alluded to, maybe they're surprised a little bit that they're getting that kind of information or discussion from their orthopedic surgeon?
Yeah, probably. I mean, to some, it's like a relief, they're glad somebody said something or made them feel like, if you're nervous or panicking or, scared, like that's okay. Like this is a normal human emotion and matches this scenario very well. Yeah, so if you're feeling that, don't feel bad. Like that's part's normal, but what's not normal is, not addressing it in some way or not getting the support you need to help yourself with those feelings.
Right.
And all the other stuff that's going to come through this whole process. Like it's overwhelming. And so for a large part of the, population that we take care of are young kids that have not gone through a lot of these things. They haven't had these experiences yet. And so it's all brand new and it can be just totally overwhelming.
Yeah. Do you think that point just about kind of legitimizing the injury and their experience is important? And I guess the other thing I was thinking is for a lot of these, young athletes, you mentioned they haven't had this experience before. And I'm just wondering, kind of, you combine that with sort of this idea that I'm an athlete, I've got to push through the pain, that they feel like they have to kind of carry it all on their own shoulders, or that seeking out help is a sign of weakness.
Yeah. And that becomes, a very difficult thing to work through, especially with certain sports where there is this culture that you're not supposed to talk about feeling pain or having an injury. It is looked at as a sign of weakness if you go to the trainer and ask for help with something's bothering you. And that has to be undone. Like we have to just throw that in the garbage, and we need to create an atmosphere where kids are totally comfortable saying, hey, something's going on. Like I need to get this checked out or whatever. I mean, there's a little bit of a balancing act in that, some guys will use this as a crutch and as an excuse and the way to get out of stuff. And that's what the coaches are afraid of having happen. They don't want everybody showing up going, something's going on, so I just don't feel like running today, coach. Like I don't need to do the conditioning.
Yeah.
But we really need to make kids feel comfortable that they can let us know when things are going on so it can be properly addressed.
Yeah. And I think, Roddy, you're kind of alluding to some inherent contradictions within sport, right? Like on the one hand, yeah, you want to kind of push through, and the mindset of achieving goals at the highest level requires that you handle pain and deal or work through challenge. But on the other hand, you don't want, especially young kids, as you mentioned, I guess, to be doing too much or kind of withholding information when maybe legitimately they're not feeling, when something's wrong or when they're in distress for a reason.
So that becomes tough because, then somebody that goes through a significant injury and, they worry about, and then they start to feel that isolation from their team because they're not participating in all the activities in the same way. They might be there, but they're not running the drills. They're not doing conditioning and suffering with their teammates and going through it and getting through it. And then they start to get, there's a little bit of a stigma now because they're an injured guy and the coach isn't, seeing them, praising them, letting everybody know when they've done well. They're not receiving that kind of feedback.
Yeah.
It's just become very tough. It's, it's much easier for somebody, that's further along because they've been through some cycles of it. They've established a little bit more, overall self-confidence. And so those things they may affect them less, but it's very tough for that young group.
Yeah. And do you see in particular that, for those with less experience or younger athletes, that they do struggle more to accept or come to terms with the injury or maybe to cope with it over the course of their recovery?
I think there's probably some of my athletes that have handled it less well than I even knew. That became apparent to me from the, some of the information that both you and my patient shared with me of her experience of what she was going through on her way back from the knee injury. Mm-hmm. So that it can be. Yeah.
And in terms of, I guess, these anxieties or kind of worries, do you see that? And again, I kind of appreciate your role as a surgeon. So maybe you're seeing athletes in a certain capacity, not so much on a daily basis, but in your experience, do those emotions or the worries, does that impact the athlete's recovery or their progression in some way?
Definitely. So I think it can be two-sided. So I think if they're having anxious feelings, they're going to be a little more timid going through some of their rehab, and that's going to limit their progress.
Yeah.
So that can be really challenging. You try to talk them through it and stuff like that. It's the whole thing is very challenging. So
yeah, sure. Yeah. And I mean, again, like you mentioned, it's perfectly normal or understandable for the athlete to have worries and concerns. And so it's hard, I guess, for those in some ways not to have some impact on their recovery, I guess, either maybe behaviorally. I'm just thinking, like if the athlete thinks, well, this is not going well, or I don't think I can come back, or I'm not sure I'm going to get back to that same level.
Surprised that sometimes they're having those thoughts, and then on the follow-up visit, like a little amount of reassurance, just letting them know, like, you don't have anything to be worried about right now because at your stage, you're actually ahead of what I was expecting. So sometimes just that encouragement and reassurance that this is what it's supposed to look like. And actually, maybe you're even doing a little better than we thought. And then all of a sudden their whole mood changes. So sometimes it's just, they have no idea like what to expect. And then you let them know where they are in their progression, and all of a sudden it changes it. But another thought, this is what I was wanting to say a minute ago, but another thought that I've had is, if for some reason there's some aspect of the recovery that's not going well, and not necessarily related to anybody's, fault or anything, but let's just say for whatever reason, the person's not, getting their strength back as fast as we wish. I think some of that psychological readiness may come from just the fact of knowing that, hey, I know I don't have as much strength back yet. And so that's what's making me feel hesitant. Right. It may not be some other, deep internal thing. It may just, they're recognizing that everybody else is saying, like, you're supposed to be ready at 6 months, but I know I'm just not feeling, I'm not, generating enough force and power in that leg. I can see that I still have atrophy in my leg. And, these are some examples that happen with like ACL injury, for example. I think some of that may be a part of it, that, we say that the psychological readiness to return is a predictor of their ability to return to that same level. But in some cases, it may be that literally they just need more time physically to recover.
Right. So I want to talk more about that issue of time, because I know for athletes, that's front and center in their mind, right? Like,
First question, concern, how long is it going to take?
Right. And so when they have that time, like, or when you say, let me ask you this, do you give them a specific time frame, or how do you kind of?
I think it's irresponsible to try to predict the future in that way. And I tell them this. And a lot of our protocols have moved more to a criteria-based progression rather than time-based. Yeah. Some of the things are rigidly time-based because of the biology of the healing and the amount of time we know that it takes tissue to respond, change, and heal. And then, but then some things you can go a little faster than otherwise if you're moving easily. But I explain to everybody, when it comes time to assess your readiness to be on the field or take the next step in whatever phase of recovery you're in, we're going to evaluate it. And then in our case, let's just take, for example, like one of the common ones that we deal with ACL injuries. When it comes time to make the next step in the progression, we actually do some video tests, and we slow down the video and we watch to see what the leg's doing. So then both me and the athlete and the parent and whoever else is involved, they can all see the same things. And I tell them, look, when you do this, step cut, when you plant your foot and I see you change direction, I want to see that your torso's in line with your hip, in line with your knee and ankle. If your knee buckles in, or if you're not getting, if your trunk tilts, like I show them the elements that demonstrate if they have the strength necessary. And then it's not my opinion, and it's not how I feel that day. And it doesn't matter that it's been 6 months or 7 months or 4 months. If you can perform the task and you can keep your body in position to keep your knee safe in this example, then you're fine. If you're not, then you're going to know it too, because you can see it. And I'm going to show you what you want to look for.
Right. So
that it makes it easy, because we just look and it's on the tape.
Yeah. So rather than kind of having this issue of time, I'm going to get back by 6 months, or, the doc said 7 months, and that's kind of implanted in my mind is when I'm returning. You're suggesting a shift.
Yeah.
Go ahead.
The easy way to explain it to him is like, look, 6 months, if I say that, it doesn't make any sense. Like, if you sit on the couch for 6 months and some other guy trains 6 days a week for 6 months, how can you be the same person at the end of that 6 months?
Yeah,
it's not possible.
Yeah.
And there's no magic switch that gets flipped.
Right.
Once you pass these time barriers.
And so when you shift the focus onto the criteria, that then kind of, would you say, eliminates or kind of reduces the importance of the time factor? And I love how you said that you show them visually so that they can see kind of what, where maybe there's decrements in their movement patterns. What impact, I guess, does that have then for the athlete? Like when you walk them through and
it only matters if we are afforded extra time before their whatever season or event or thing that's coming up that they want to be ready for. Mm-hmm. If there's extra time between now and that start, then they don't care. But if it's coming and we're limited to that certain amount of time, then sometimes we just have to work with what we have. So
right.
I'll give you an example. We had a football kid dislocated his shoulder in spring football practice, and he's going to be a senior in high school football. And then, he didn't really have aspirations to play in college. So this was it for him. Like high school, senior football, there's never going to be this any other time. Yeah. And so we had our window of time, and that was it. It was like, you got to make yourself ready to play football if that's what your goal is. And we're going to in this case, we were willing to accelerate the program and maybe take a little additional risk about a repeat injury, because there really wasn't ever going to be that, that sport and that time for him. So time can become a factor based on circumstances, and especially with in-season things, when you're talking about getting a guy ready for that week's game, or the playoffs are in 3 weeks, we got to be ready for that. And there's times where you either accelerate or decelerate your program. And it's, of course, always within, a reasonable and safe thing for the kid overall. But there are times that we talk out and then in certain circumstances accept additional risk to go a little faster. And in that case, the time becomes a real, there's heightened anxiety around the time. There's no way around it.
So it sounds like the criteria considerations, again, are offset by the proximity of important competitions. And in the example you give, when the future is now, so to speak, then there's maybe some cost benefit analysis to,
there's only one opportunity. And I think the summary of this whole thing is that return to play is very complicated. There's a number of different factors that we're weighing and considering through all of that. And sometimes there's not a right answer. And sometimes we take additional risks. Sometimes we, accept that we're not going to be able to, perfectly line up every category, before something's supposed to happen.
Yeah. So what would you say, and maybe this is hard to generalize across injuries, but what are some of the key factors or indicators that you're looking at to determine the athlete's readiness? I know you mentioned time.
So first thing, from like a physical exam standpoint, you want to see full range of motion of the joint. You want to see that there's no swelling. It needs to be stable. And then you want to see a return of their strength. So you can test strength in a various number of ways. And you want to see that they've got either a return of equal strength to the opposite side, or that the side-to-side differences are what you expect, or that it's within an accepted, range. And then so from there, then we would begin a progression back to the activities. And then the other factors that are come into consideration are, what sport do you play and what's the injury? What's your role on the team? What aspirations do you have for play that's beyond that current season or level of play? And then you start getting into all kinds of stuff. So, agents and, fan expectations at the higher levels, contracts and things with baseball get really crazy with guys that are in the big leagues and they get moved down to the minor leagues for rehab assignments. And you can only get sent down to the minor leagues so many times before, they say you only have so many options. Right. And this is a term in Major League Baseball for how many times you can go down to the minor leagues before they have to, release you, or, it's open for another club to be able to pick the guy up. So all of these things start to get played into it. And sometimes you're juggling a bunch of these things. The main thing is that you see that the whatever joint or limb you've taken care of is healthy and looks ready to resume the training and practice and approach to competition that you would expect.
Right. And it sounds like
the difficult thing about this is everybody that's involved could tell you a different answer to some of these questions, because there's no consensus.
Right. And also, given the proliferation of information on the web, does that make that all the more challenging for you in your role?
It can, just be in case, in terms of what the public may have access to may be simple media outlet kind of reports, which are obviously very different than peer-reviewed journal articles that, show research studies on the subject. Yeah. So you could have what appears to be a very legitimate source that's giving, information that may be incomplete. And then now we've got to have that discussion and undo whatever info they've gained from that.
Right. Right.
So, but that's this is the whole role of sports medicine, and this is our job. these are the discussions that we're having every day, is how do we safely get you back, and what's the timing, and what has to happen? What do you have to show me before I'm ready? And what does ready mean? Am I ready to train? Am I ready to, practice? Am I ready to compete? Like, these are all stages that you have to go through in order to safely do it, we believe.
Yeah. Well, and that's a great point, right? It's not just like you're not just returning to one thing at one point in time, but it's, I guess, a stage like process where there's progressions of return to training and sort of
Yeah.
more intense forms of sports specific things, ultimately competition.
Nobody goes 0 to 100. I mean, I think sometimes people think that, like you said in the 6-month example, it's like, okay, like today is the month 6, and then tomorrow or tonight I can just go to practice and like I'm just like I always was. Well, that doesn't even make sense. But we use like this dumb analogies about, you don't like, if you're going to run a marathon, I don't go run the marathon tomorrow. Like, you got to train, you got to prepare, and you got to work your way up to that. And most people that are involved in sports understand that, and especially, people that train and are at higher levels. But, sometimes you think that you're just going to like flip this switch and then like magic, everything's just back to normal.
Yeah. So would you say, I mean, it sounds like this whole process of determining readiness is complicated, multifaceted, that the higher the level of the athlete, the more multifactorial, I guess, the decision making becomes, or the
more people that are weighing in on the decision and have interest in the the process and the outcome, and it can become very difficult. So obviously try to have sound principles, and you try to sometimes just talking it out with the athlete and understanding what their expectations are and what their goals are, you can kind of arrive at, okay, like option A is much better than option B based on what you're telling me. So again, it goes back to that communication and opening that up.
Right. In terms of the expectations that you mentioned, are there similarities? Like, let's focus in more on this return to play. So I know you said you sort of use the analogy of a marathon, that you don't just go run the marathon, you build up to it.
Yeah.
Is it common for the athlete to expect that, okay, I'm finished my rehab, I've done all the things that the doc and the athletic trainers wanted me to do, now I'm going to go in and play at a high level? Is that generally the expectation, or not necessarily?
Well, I think in our practice, we certainly try to have a lot of these conversations well ahead of that time. So it's never like, okay, the person's coming in, it's been 7 months since their surgery. Now they're walking into the office and they have no idea what I'm going to say. Right. Yeah. Like, that would be the worst scenario.
Right.
Like, they don't know if I'm going to tell them you need 3 more months of rehab or you can play tomorrow. Like, nobody should be that far in the dark as to what's happening. Yeah. So again, managing expectations, educating early and often as to what the whole process is going to look like, so that, you understand where you are, and you're managing yourself to some degree too, but you kind of you can know and anticipate what's next. Okay. I've been training really hard. We've started some small things with sports specific stuff. Now I'm going to, maybe the next stage is practice, but without contact. Right. And then the next stage will be, practice with contact. But again, so we're going to limit minutes and we're going to manage the workload and things like that. So, again, we try to have all this discussion really all along the way. Like, we give them a little bit of a brief overview at the beginning, and then each time we're together, we're really talking about the whole thing. Yeah. Not just like this day and the next 4 weeks.
Yeah. So would you say that's helpful for the athlete to get a sense of where they are relative to the whole kind of recovery progression or picture?
I mean, I hope it's helpful, and obviously we're trying our best to communicate well and be helpful. But I know that sometimes, I can say something 5 times and I can just see that there's like, it's not registering.
Right.
They've got their own determination of how this is going to go and what it's going to be. And, they're rather uninterested, in my opinion.
Right. And given your wealth of experience, are there, I guess, tools or strategies or maybe insights that you've picked up on what maximizes that communication, or what helps the athlete walk away with some understanding?
Yeah, just having them, hearing them say it back, and listening to what they're talking about in terms of what their plans are and where they're going, what they're doing. Some kind of get off track with our recommendations, and we just try to keep them on course. But of course, naturally, some people are just going to do what they want to do.
Right.
Again, we just try to provide all the information. From day one, they have the rehab protocol that gives them the whole outline for the whole program.
Mm-hmm.
So they have that to look at and review. And we just keep, re-emphasizing these things each time. And then and a lot of communication too, not just with them, but it's with the mom and dad, and it's with the trainer at the school, and it's with the coaches, and it's with the physical therapist. So there's always like tons of text messages flying around, and it's kind of funny. Like sometimes it's, that the whispering game or whatever, I don't remember what it's called, but where, I said something to one person, and then by the fifth person it got to, it's like, I didn't say that.
Right.
So sometimes you're undoing some things, but you just, again, the main thing is just stay in communication, make sure that, and here's a big thing. This was great advice given to me by, a sports medicine doc that I really look up to. His name's Pat Connor in Charlotte, North Carolina. But his emphasis was, make sure that the thing that you say to the athlete is the same thing that you say to the coaches and to everybody else. Make sure everybody has all of the same information.
Yeah.
And that you're not withholding something from one or the other, because that's when you get in a real bind of, especially when things are not going well. You told this guy this, and he said you said this, and if those aren't matching up, man, then you're having a long discussion with somebody,
right?
Trying to explain, why one thing to one person, another to another.
Yeah. But so just being transparent and consistent is important, so that, you're not creating problems.
You're sharing the same things with everybody.
Yeah. And in terms of, I guess you mentioned getting the athlete to repeat back kind of what they've heard, or sounds like you're asking some questions to the athlete about, what are your plans, and if it's like, oh, well, I can see from where they're going that we're, nothing of what I said quite registered, or like just having them talk about their plans, or reiterating what, in their own words, what you relay to them. Sounds like that's important in sort of gauging their understanding. Is that right?
Yeah, I think so.
Yeah. And in terms of, I just want to touch on this issue of trust, which you allude to in your previous comment. Are there some things that, from the athlete's perspective, help build trust in you, the provider?
I mean, the biggest thing is if you take care of them and they're starting to feel better, then they know, okay, seems to be on track. And if they weren't sure beforehand that we were going to do the right things for them, they start to feel better, then they know that what you said was coming true.
Right. So just as they sort of have the benefit of
they get feedback from physical therapy too. When therapy tells them, oh, we've taken care of a bunch of, your doctor's patients and you're doing really well, like they did, or, you're even ahead of where a lot of his other patients were, like all that reassurance is powerful medicine.
Yeah. And on that note, what are some of the, I guess, kinds of support or maybe reassurance that athletes typically need in your experience?
Well, a lot of it comes from, mom and dad, and it comes from their teammates and their coaches and things like that. Whenever we have anybody around, I don't always have access to all of my patients' support system, but whenever, I have that, I try to emphasize to them how important that is, and encourage the support team to encourage the athlete, be there for them, listen to them. I tell one of the big questions always is like, kid has surgery, and then like that night or the next night, like his team's playing, and they're like, the parents always ask me, like, can he go to the game? It's like, yeah, please, like, get him out there. Like, that's his whole social system. Like, and not only for him, it's important to go do things and be around his friends and be there at the same place that he would have been if he wasn't hurt. But also it's important for their morale to see this kid on their team, like, supporting them. And, you know, look how much effort he's making. He just had a big surgery. Now he's out here with us. Like, those kinds of things for the team are very important, I think.
Right. So it's not just necessarily beneficial for the athlete to go and engage with their team, but the team can also sort of get that morale boost when they say, oh, like, you know, Johnny's making good progress with his rehab, or, you know, look how far he's come since we last saw him.
Yeah. Yeah. And then also for them to see him and see what he's going through, like, oh, he's got this huge bandage on his knee and a big brace, and he's, you know, gosh, he can barely even walk with his crutches. Like, he's really going through a lot. That helps him be in a scenario where people can provide the support to him.
Yeah, right.
Because he's there with them. If he's sitting at home on the couch, like, the whole team isn't going to drive over to his house. I mean, that'd be a pretty cool effort if the, you know, coaches and the team, like, did something like that. But, you know, most likely his couple of close friends will come visit him, check on him. Everybody else may ask about him, but then he doesn't know that they're doing that. He's not receiving that kind of emotional support, you know?
Right. So what if the athlete says, though, oh, you know, like, it's hard for me to kind of, I was supposed to be there training, or I was supposed to be going off to this competition, and now I'm just stuck with this giant brace on my arm and leg. Like,
Yeah.
I don't want to get all the more frustrated. What are your thoughts on that?
I mean, so if they think that they're going to feel worse about the situation by being in the environment, then it's worth considering, you know, whether or not, you know, you want to carry that out.
Yeah.
I think for the most part, even if they thought those were the kinds of feelings that they're going to have, I think that's going to help them get closer to that acceptance. And I think they're going to benefit more from the support that they would get from the coaches and the other parents. And, you know, everybody's gonna be kind of paying attention to you and showing you some love, you know, when they see you in the scenario. So yeah, I can see where that could be a situation. And I think it would turn once they were actually there.
Yeah.
I think it would turn into a positive.
Right. In terms of, obviously there are differences, I guess, in terms of athletes' physical healing, or, you know, some athletes maybe are slow healers, some are just fast healers. But are there differences that you notice in terms of athletes' ability to make an effective recovery, maybe above and beyond just their healing properties or capabilities, I guess?
I mean, it probably has to do with how well equipped they are to handle any kind of challenging situation. I don't know that there's necessarily dramatic differences in how fast or slow one person heals compared to the other. I mean, it's all probably in what the range of biology, right? Like, there aren't magically fast healers and, you know, people that are slow for some reason. But you know, I think one of the things that we've had a discussion about before is in terms of, like, managing the expectations and then strategies for managing the pain and things like that. Like, the people that are handling that side of it better may have some advantage in the early going versus the person that maybe for whatever reason their pain threshold's less, or, you know, the pain is creating more anxiety for them than somebody else, and they don't have a strategy in place for how to deal with that, and they're not getting support from mom and dad and things like that.
Right.
I think those are things that could lead to the early progression being slower or easier.
Right. So, like, particularly in the initial injury phase, things like pain management strategies or coping abilities may sort of distinguish the trajectory that the athletes are taking, at least initially. The pain management, are there sort of strategies, I guess, that athletes can use, or that you advocate, I guess, in terms of your practice?
beyond medication and the modalities in physical therapy, when we start physical therapy is for most injuries the day after a surgery. And those are some of the things I'm actually looking forward to learning more about from you.
Yeah.
And in terms of some things that you had mentioned, uh, in terms of a strategy and an approach to managing pain, because I don't think I've had enough exposure or implemented any of those kinds of strategies from like a sports psych perspective.
Right.
But
Yeah.
I think it would be great. I mean, we're always looking for ways that we can reduce opioid consumption and really anything that can be beneficial to manage pain. And then, because once you get through that phase, I think a lot of the anxiety goes down quite a bit.
Yeah. Well, and on that point, I guess, kind of thinking of pain in its broadest sense from a kind of psychological standpoint, like pain might include things like loss of a valued activity, or, I've lost my sense of who I am and my identification.
Yeah.
And so, kind of working at pain on two levels. It could be sort of on a physical level, where maybe from a sports psychology standpoint, it's kind of about using simple strategies, things like breathing, that kind of help change the physiology of what someone's experiencing.
Yeah, breathing awareness is big, right?
Yeah, and even if someone is catastrophizing or having all these what if kinds of questions, which are really normal, then that does influence hormones and blood flow. That's your area much more than mine, but certainly in terms of if they're having ongoing or predominance of negative emotions and thoughts that continue over the course of recovery, then maybe that does impact things like blood flow to an injured site. And so if you can help the athlete with things like breathing, where they're kind of just regulating what's happening on a physical level, or a practice we often use in sports psychology is imagery, where you're seeing yourself maybe engaging in certain practices or technique, or maybe it's even seeing a body part healing itself. There's some really interesting and powerful research actually, where they were looking to see the role of the nervous system and its impact on muscle mass. And I guess typically researchers sort of look at the role of muscle mass in its impact on muscle strength or function. But in one study, they were looking to see whether the neocortex, the primary neocortex, had an impact on athletes' muscle strength. And so they had a group of individuals, healthy individuals, and they put their arm in a cast. And then there were, I think, 15 healthy controls that sort of had no cast, engaged in their usual activity. And then they divided the group, the 29 individuals that had the cast on their arm, into two subgroups. One had the cast on for 4 weeks, and they did just nothing, basically. And then a second group did imagery, where basically 5 times a day, they simply imagined themselves contracting their arm 52 times. And they did that 5 times a week over the course of the 4-week period that their arm was in the cast. And they found that simply imagining yourself contracting helped attenuate the loss of muscle strength, or reduction in muscle strength, by 50% compared to the other groups. And and it also had impact on sort of the activation of the muscle. And so I love that study, because I think it's sort of a nice illustration of kind of the mind-body connection. And simply imagining yourself can really have an impact on what's happening in the body. Do you, I guess, if you were to offer some thoughts on the importance of confidence for the athlete's recovery, what are some things that help the athlete feel confident that they're progressing or that they are ready to return?
I again, well, so, on our end, reassurance throughout the process that they're meeting the milestones that we're setting, showing them what our goals would be at each phase, and then showing them where they're at. Um, you know, I don't know how you actively work to instill confidence, but we just try to do it through our conversations, through the reassurance, giving them goals to set and letting them, hitting those little milestones along the way. It's like we're trying to create a little pattern of success.
Yeah.
And when they see each little success happening, hopefully that gains some momentum so that when we get to the bigger tasks, then they feel like they can do it.
Right, right. So just having that track record of success, like I've done this before, or I've done smaller things, helps build the belief
Just
that
just the general feeling of like, hey, everything else you asked me to do, I've done. So why could I not do the next thing you asked me to do?
yeah,
So
yeah. So it's perfectly logical to believe you're going to be able to do this next sort of more challenging thing because of the previous progression that's occurred.
with certain injuries that we deal with too, one of the things that I've done over the last few years is I've actually given kids like some of my favorite sports psychology books to read, and I tell them like, look, you're physically not able to compete and practice and train and do the things that you want to do right now, but you can read and you can, make your mental game stronger. You can get better in this way when you can't get better in the other ways that you're used to working so hard at. So I try to encourage that stuff. But again, I think it's kind of a new introduction to the practice, and we're trying to figure out, exactly what should that system be? How do we help, young people that have such a variety of levels of self-confidence and self-assuredness? Of course, some have more than others, and even some of the ones that appear to have it don't, but they just really increasing their exposure and letting them know, hey, this is something you can work on and get better at, and it's going to help you perform better.
Right. So just kind of clarifying or having conversations with the athlete that there's different facets to their game, their performance that they can be working on during the rehab time frame. Yeah.
Yeah.
And in terms of, I guess, if you were to offer some advice or suggestions to an athlete who's recovering, or maybe even just one piece of advice, what would that be to the athlete in terms of making an effective recovery?
Well, I think it's just, following the steps, not, staying focused on the moment or moments that are in front of them. So really just try to think of things in terms of that day's recovery tasks or that week, not trying to project into the future and play those games of what's going to happen to me and things like that. So staying focused on each phase. And then, I try to encourage them to learn and read and understand how they can use their mind both for affecting their recovery, which brought up visualization. So early in the process, we start to encourage them that, start imagining yourself on the field, start to see that and make it more and more clear over time. And, I'm not the best visualization coach, but I teach them about some of the things that I learned over time.
Yeah.
But I explained to them how initially you're not even going to be able to do it. It's going to be too difficult. And then the more you practice, the more vivid the picture will be, and you can start to, see the colors and feel the fabric of your uniform. And we have some of those discussions too.
Right, right. My last question, Roddy, are there benefits or upsides to injury?
Usually, generally, no. I mean, it would be much better if we could just take the strategy and steps to prevent it from ever happening, rather than, glean some benefit from the fact that it did. But, if there's anything, I think sometimes that the time away gives people new perspective. It may create a little more desire and appreciation for what they love about their sport. There is that time where they can, get a little better and stronger mentally. I think for the athlete that's never had an injury, the difficulty of the process does help them gain some confidence because they then have gone through something and accomplished a goal and achieved and shown themselves that, hey, I can overcome something very difficult.
Yeah.
So there can be things that are good that come out of it, but I think overall we'd prefer to have a strategy where we keep them away from me.
Yeah. Yeah. On that note, I appreciate all your excellent insights and comments and strategies and ideas. So thanks for taking the time to speak with me today.
You having me. And it's I always enjoy talking about this. And some of it's really complex, and I think conversations, especially kind of outside of our discipline, like we've had, where I get to hear your perspective. It's really helped me a ton in adding to my practice, and you've been a great resource for our patients. I really appreciate that too. Thank you.
Yeah. Great to have you, and thanks again for your time.